Hi everyone, welcome back to the Aspen Club. My name's Harrold, and I'm honored to be with you here today to talk a little bit about breathing and how important it is in regard to your overall state of mental and physical well-being. Today I'm here to talk to you about the inhale. And the inhale is one of the most undervalued tools in regard to being proactive, in regard to keeping your mind clear, keeping your belly free of inflammation, and keeping your heart rate and blood pressure as low as possible during stressful times and the challenges that we're all going through in life. So if we go back to when we were a baby, when we were first born, we're all designed to be nasal breathers. Every animal on earth breathes through its nose its entire time unless it's hunting or being hunted. Somewhere in our younger years, between the ages of 8 and 15, we leave the nasal breathing and we start to shift into mouth breathing tendencies. And these mouth breathing tendencies, while they make us feel good initially, in the long haul, they're debilitating to the health of our body, the health of our mind, and the health of ourselves. So today I'd like to talk to you about the inhale. Now, moving the inhale downward, we want you to breathe through the nose. And as we breathe through the nose, here's a little script of what's happening. We're taking the air up through the nasal channels, up into the sinuses, into the respiratory glands of the brain, and the air moves down into the lower lobes of the lungs. The diaphragm muscle, the primary muscle of inhale, gently comes down onto your gastrointestinal organs and gives you a wonderful massage. And as the diaphragm muscle presses downward in its ability to help us digest, the rib cage begins to expand. And as the rib cage expands, we can expand the lungs to their full 5-quart capacity on the inhale, giving us vitality and energy throughout the day and a restful sleep at night. As the ribs expand, the intercostal muscles between the ribs contract, working in concert with the diaphragm, and the ribs expand. Now remember, the lungs are passive, the lungs aren't muscle. So the lungs can only expand as much as the diaphragm and the intercostals are strong and your rib cage elastic. So breathing through the nostrils, the diaphragm moves down, and we have great support in our low back. And this good posture in the low back allows us to stabilize our hips, stabilize our lower body mechanics, so that we're more grounded and rooted as we move our body through the rigors of our day, whether it's in athletics and taking care of ourselves, fitness, wellness, or even in the workplace. So on the inhale, visualize downward energy as the diaphragm's moving down. The oxygen, the nitrogen, the helium, the carbon, it's all moving down onto your gastrointestinal tract, and it creates great posture in your low back. And that great posture in your low back, the mind sees that, and it allows us better mental posturing, where in the past we might have shut down or we became emotional and we used a lot more energy than we needed to correct a conflict or correct a relationship that wasn't the healthiest. So slowing down the inhale, even right now, feeling that downward flow of energy and that wonderful massage you're getting in your belly. And as the diaphragm comes down, you get a great massage on your liver, gallbladder, and on your stomach, spleen. And when we combine all these organs, there's a nervous system there called your enteric nervous system. And every time we breathe through the nose, the enteric nervous system gets a massage. And 95% of the serotonin hormone is secreted from the diaphragm moving down into this enteric system. And when the serotonin is secreted, the heart rate and blood pressure are stable. Digestion, elimination, assimilation is amplified. And it's really easy to get from point A to point B in the thinking process, in the conceptualizations of what we're trying to achieve, as we're all high performers. We're all result-oriented people. And stabilizing that inhale stabilizes the mind. It stabilizes you. And then as it stabilizes the mind, there's a greater stability in the lower body, and you're more grounded in your body as you move through your day, moment by moment by moment. And you'll use less energy as you go through the day, and you'll work harder, not smarter. You'll be calmer rather than tense, and you'll be prepared for excellence just about at any moment during your day. So let's begin a little experience of moving the diaphragm. If you wish, let your eyes close and bring your hands onto your belly. And as you inhale through your nose, allow the belly to swell out into your fingertips as if you were doing a reverse sit-up. The organs are moving away from their normal attachments. And then when the belly can't swell any further, you'll feel the breath come up into the lower ribs and the lower chest area. And you'll notice that will expand east and west. And as you complete the inhale and the air moves into the top of the lungs, you'll feel the upper rib line lift towards your collarbone. That is a whole breath. That is a complete breath. And when you have a whole, complete breath through your nostrils, chances are you'll have whole, complete messages as you communicate with yourself and as you communicate with others as you move through your day. So let's practice this. Let your eyes close and let's focus on the muscles of inhale. Taking the breath through the nostrils, follow the energy up into the brain and then down through the trachea, the windpipe. And you can begin to feel the lungs starting to fill as the diaphragm presses down onto your organs of the abdomen. As the belly swells, you'll begin to lift the breath up towards the collarbone, and it's much like you're filling a vase with water. And you want to imagine this filling the lower lobes of the lungs first and the upper lobes of the lungs second. This will trigger a relaxation response in the brain and the body, and you'll be calmer. Continue to practice this. Breathing slowly, let the belly swell. Breathing slowly, begin to let the breath evolve as the rib cage expands. You'll reach a point where you can't inhale any further. There'll be a slight lift of the upper shoulders, and that's a complete inhale. Let the exhale be whatever it has to be, but usually slower is better. If you'd like to challenge yourself, slow the breath down and try to inhale 5 or 10% longer than you did the last couple rounds. And begin to notice how that makes you feel. Slow down. Feel the breath moving in and out. And try to relax your muscles, your fascia, the skin. Good. Slow your breath down and let emotions and feelings flow freely without being censored by the ego. Know that you're always doing your best. And then slow the inhale down even more and notice the quality of the mind, the quality of your mental activity. Beautiful work, everyone. I invite you to continue to work on this inhale process every spare moment you have in your life until it becomes unconscious that you're always taking the longest inhale as possible, moving the diaphragmatic breath up and down and up the spine. I also invite you to allow your fingertips to rest on your belly when you're falling asleep at night. And practice this for 2 weeks or so. And as you fall asleep at night, it's easier for the brain to introduce new material to your conscious mind during the day when you're practicing something as you go from conscious to unconscious. So learning this diaphragmatic breath, or relearning this breath, will happen very quickly for you if you do it when you're falling asleep at night with your hands on your belly. Boy, I'm really glad to be with you today, and you're going to get so much out of this nasal inhale. Use it all the time. Use it at work, use it at home, use it in your self-care routines, your training routines, and you'll get a lot more out of less. My name's Eddie Harrold. I'm here at the Aspen Club. I can't wait to see you again. Have a great day. Go be great.